Chasing a youthful glow is nothing new, but knowing what not to do is the real secret to looking your best. From fillers to facelift, the world of cosmetic procedures is full of myths that could put results and your health at risk.
Well, today, as part of our I Would Never series, we're talking to a leading plastic surgeon who's busting the biggest beauty lies and revealing the do's and don'ts you need to know before going under the knife. And for more, we're joined now by plastic surgeon Dr Jack Zoumaras. Welcome to you.
See you again.
So, Jack, you say don't ever get plastic surgery to look like another person. Why is that? Because you'll never get there?
Yeah, I mean, yeah, exactly. I think plastic surgery is a huge decision. It's permanent, and it's something that you really need to consider that you're doing it for the right reasons. And the right reasons are you're doing it for yourself. You're not doing it to mimic someone else in a magazine or on social media, and you're truly doing it for yourself and not doing it for someone else. And I think that's the most important thing that I have to delineate when I consult with prospective patients, that they're doing it for the right reason. And they're not doing it, for example, for a revenge plastic surgery because something has happened with a previous partner or something like that. So it's critical that you're doing it for the right reason. And it's impossible to look like someone else because everyone's an individual.
What would be the right reason?
Well, I think the right reason is something that you're doing it, that you've thought about it for a long time.
And something that really bothers you.
Yeah, and it's something that really bothers you, and you've given it good thought, and you've been into the position, OK, if I do this, is this going to resolve the issue that I have? Or is the issue just physical, or is there a psychological impact or basis to it? And it's something that we have to delineate as a ethical practitioner as well.
Yeah, there's a lot to it, isn't there? You say you would never use a permanent filler. Why?
Yeah, well, being at the plastic surgery side of things, when I get referred things when things go wrong, I've seen a lot of permanent filler distort facial structure. And I don't know what it's been, but over the last 3 months, I've probably had multiple patients during surgery that have had permanent filler around the eyes, for example. And you can't really remove all of it because you're damaging local structures as well. So that's the reason why I would recommend not to get permanent filler. And also at caution just with injectables in general.
Yeah, you say don't ever smoke. What does smoking do to our appearance?
Yeah, I mean, smoking is bad for your health in general. Like, it's bad for your cardiovascular system, your respiratory system, so just general recovery from surgery. And we know that smoking also decreases blood supply, so it causes vasoconstriction of small blood vessels, and that means tissue healing. So it interferes with your actual healing. And it also just ages as well. It ages you as well because it causes...
You say you would never get fat-melting laser treatments on your face. Why is that so bad? What is it and why is it so bad?
Yeah, good question. So essentially, as you know, around the whole world, a lot of people are getting injectables because injectables do work because as you age, you do lose volume in the face. So some devices, there's a lot of non-surgical devices that use ultrasound technology to aim to lift the face non-surgically. But those devices, unfortunately, do have a detrimental effect on your facial fat. So you can lose volume, which can then make you look aged or a different appearance. So there's always a caution with regards to that. And I certainly wouldn't get it myself.
There you go.
The other thing that you say that you certainly would never do is go overseas to have plastic surgery. What are the risks there? Well,
I think there's so many risks and there's so many bad stories out there about even extreme things like people getting the wrong operation, or there was a case in England that was in the papers last year about someone losing a kidney at the same time, which is just horrendous. But I mean, obviously that's an extreme. But from our point of view as in the Australian Society of Plastic Surgeons, we've actually got a kind of internal campaign now to just basically report patients that have had surgery overseas and maybe not so good outcomes. And I, for one, just 2 weeks ago, had a message from a patient that I was going to have to do surgery on earlier this year, but she ended up going elsewhere and now she regrets it and she wants to come and have corrective surgery. So I think you just don't know the standard of the practitioners when you're overseas. You don't always meet who they are. Like, I've heard stories from my patients, they go there and they meet them in the morning, like we're meeting today, and then have surgery 2 hours later. And it's almost like pressured to do it. And then you don't have the follow-up. It's not to say there's bad surgery out there, but I think the standard in Australia is very high, and I think the standard overseas is probably not as high.
I might need to cancel that trip to Turkey. Thank you, Dr. Jack. Appreciate that.